Dengue is a viral infection transmitted to humans through the bite of infected mosquitoes. The virus responsible for causing dengue is called denguevirus. Severe dengue is a leading cause of serious illness and death. Denguevirus is transmitted by female mosquitoes, mainly of the species Aedes aegypti, to a lesser extent, A. albopictus. These mosquitoes are also vectors of chikungunya, yellow fever, and Zika viruses. Dengue is caused by a virus of the Flaviviridae family, and there are 4 distinct but closely related serotypes of the virus that cause dengue: DN1, DN2, DN3, and DN4. Transmission: after feeding on an dengue-infected person, the virus replicates in the mosquito midgut before it disseminates to secondary tissues, including the salivary glands. The time it takes from ingesting the virus to actual transmission to a new host is termed the extrinsic incubation period, IPE. The IPE takes about 8-12 days when the ambient temperature is between 25-28. Risk of mosquito infection is positively associated with high viremia and high fever in the patient. Conversely, high levels of dengue-specific antibodies are associated with a decreased risk of mosquito infection. Symptoms usually last for 2 to 7 days, after an incubation period of 4 to 10 days. After the bite from an infected mosquito, dengue should be suspected when a high fever 4104 is accompanied by 2 of the following symptoms during the febrile phase to 7 days: severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen glands, rash. Severe dengue is a potentially fatal complication due to plasma leaking, fluid accumulation, respiratory distress, severe bleeding, or organ impairment. Warning signs: severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue, restlessness, liver enlargement, blood in vomit or stool. Treatment: there is no specific treatment for dengue fever. Patients should rest, stay hydrated, and seek medical advice. Supportive care such as fever reducers and painkillers can be taken to control the symptoms of muscle aches and pains and fever. The best options to treat these symptoms are acetaminophen or paracetamol. Ibuprofen and aspirin should be avoided. Prevention and control: if you know you have dengue, avoid getting further mosquito bites during the first week of illness. Virus may be circulating in the blood during this time, and therefore you may transmit the virus to new uninfected mosquitoes, who may in turn infect other people. Using of personal household protection measures such as window screens, repellents, coils, and vaporizers. These measures must be observed during the day both inside and outside of the home because the primary mosquito vectors bites throughout the day. Wearing clothing that minimizes skin exposure to mosquitoes is advised.
Do subscribe the channel for more videos.